Hi, I'm Dr. Nick Hysmith, the Medical Director of Infection Prevention here at Bonheur Children's Hospital. As home testing for COVID-19 has become more common, and especially now that the federal government is offering 4 free at-home tests to each household, we've been getting a lot of questions about how best to use them. The short answer is, it depends. There are a lot of different brands and styles of tests on the market, and even a fair bit of variety among the ones now being mailed out by the government. But there are some things common to all of these tests that are worth knowing. First, more than anything else, before you start, carefully read the instructions on your test. You don't want to get halfway through doing the test only to realize that you've done something incorrectly. Second, check the expiration date. All the tests should have an expiration date marked clearly somewhere on the package. They only last a few months, so it's important to double check that. Third, clean your workspace. Most of the tests suggest that you do them on a flat surface, like a table. Use a disinfectant spray or wipe to make sure it's clean before you begin. Fourth, similarly, wash your hands. Like your workspace, your hands also need to be cleaned to prevent accidental contamination of the test materials. Fifth, be careful not to touch anything you're not supposed to touch. In particular, be sure not to accidentally touch the tip of the nasal swab with your hands. And finally, you should know that false positives, meaning that you test positive but are not infected with the virus that causes COVID-19, are extremely rare. False negatives are more common. So if you're experiencing COVID-19 symptoms and test negative, we suggest testing again after 24 to 48 hours. The home tests aren't as sensitive as the ones we use in the hospital, so sometimes it takes a little longer for them to be able to detect the virus. We hope this helps answer some of your questions regarding these types of COVID-19 tests, but if there's more you'd like to know, visit www.lebonheur.org/coronavirus.